name is Monica Furman, and I just want to briefly introduce our two panelists today and then let them go ahead and get started on the presentation. So first of all, we have Judge Schma, and Judge Schma served as the Kalamazoo County Circuit Court Judge from his initial appointment in 1987 until his retirement in 2007. He presided over the Kalamazoo County Drug Treatment Court program and specifically founded the first women's drug court in Kalamazoo. Kalamazoo continues to provide gender-specific adult drug treatment courts to this day, and Judge Schma is also a founding member of the National Association for Drug Court Professionals. Our second panelist today is Ms. Valerie Moore, and Val has been working with drug treatment courts since their start. She collaborated with Multnomah County, Oregon, the district attorney, public defender, and circuit court judge to design and implement a treatment services for Portland, Oregon's STOP program, which was one of the first comprehensive drug court programs in the country. Val went on to serve as the executive director of ENACT, which was the treatment agency from 1992 to 2008. And Valerie has continued to work as a consultant in and around drug courts since then. And with that, I'll go ahead and let you both get started.
Okay, thank you. This is Bill Schma speaking, and I will get us started. The agenda is on your screen, and it refers to the various areas that we will touch on during the course of this presentation. Val and I will go back and forth with these in speaking with you and talk about different topics. To start with, just some terms to kind of make sure we're all on the same boat here. It's important that we understand and talk a little bit about the difference between a gender-specific program and a gender-responsive program. Later on, I'll make some comments about a court in Kalamazoo, Michigan, where I am, and it will be about the drug treatment court in that community, in this community, which is gender-specific. In other words, there's a court for women and a court for men in our adult drug treatment court program. Throughout the course of this presentation and webinar, we're going to address the principles, especially in the gender responsive treatment section, and that is the kind of behaviors and environment and activities that create an environment for the unique needs and characteristics that we find in female populations that come into the criminal justice system with substance use disorders that need to be addressed and responded to. Some terms related to this notion of gender responsive principles. It's probably more important than anything is to make sure and understand and that everybody on the team understands that there is a difference in the genders in the way that they enter into the pathways that get them into substance use disorders and addiction, the pathways out of those circumstances. They make a difference, and it's really important that we know about that and talk about that. There's differences in the emotions that women experience, the way they behave in the courtroom, the needs that they have emotionally. Invariably, you'll find problems with self-esteem. We'll talk about that. Invariably, they enter and present as abuse victims, and unfortunately, mostly by males. They have children with them that are usually a part of their life, and they have unique circumstances that arise out of such situations as pregnancy and the like. All of those and other circumstances make it important that the environment be one that's safe for them, that respects them, and provides them with dignity so that they can deal with those kinds of negative background circumstances. Relationships are extremely important principles in working with women, and so the policies and the programs that are presented to them and put together in the court system have to reflect that. They have to reflect healthy connections with people and children and family, significant others, and also the community around them. And of course, the services have to deal with those emotional circumstances. You have to address not just the whole thing of substance use and abuse, but trauma is a huge issue. Women have suffered considerable trauma that brings them to abuse and addiction. They invariably have mental health issues that are cross issues that also occur, and so you need services that are comprehensive and integrated and that are relevant to their cultural circumstances. All of anyone who's in a drug treatment court suffers from socioeconomic issues. The women have their own, and they're unique because of their circumstance of where they find themselves in society. That has to be addressed as well. And it's, again, important to establish a comprehensive and collaborative system of community service that will help them out. I frequently will describe an ideal treatment court system as one that's sort of a spoke and wheel diagram with the court at the center and spokes going out from that to various services in the community that are around and available or perhaps have to be created. The job of the court is to reach out to them, integrate them, and bring them into the courtroom. And so that's really what we're talking about here, and we'll be talking about throughout the course of this presentation. Just a little something from Kalamazoo about gender in the drug treatment courts, and also nationally. Nationally, women are 32% generally of the people that participate in drug treatment courts. 30, that is, of all the participants, there's 32% are generally women. That's not quite what we have in Kalamazoo today. And we presently have 102 men in the men's court, but only 21 women in the women's court. There's been a drop. I think there's been a drop nationally, I think, in women in court systems, but Kalamazoo's experienced this considerable drop. They're not quite sure why, but it's being investigated and explored. But generally, it's around a third of the participants in drug courts are going to be women. Women graduate at rates substantially below what the graduation rates are for male participants. In Kalamazoo, which is a county of about 170,000 people, they have over the years, and the women's court started in 1992, the men's court in 1997. But over the years, we've had over 550 male graduates and about 250 female graduates. And the success ratio, as I noted, has been lower for women recently. There's about a third of them that participate make it through, and it's almost 60% of the men make it through successfully. So that gives you some idea of what you might compare what your individual experiences may be. Of course, always dealing with gender, the whole point of this practice and this webinar is that best practice standards require that we constantly monitor and adjust programs as possible to account for the presence of the women in the programs. Now Val will take over.
Hello, and thank you for joining this important webinar. Having been the director of the sole nonprofit outpatient treatment agency for Multnomah County's Stop Drug Court program, we developed systems and services for our women over the course of time based on their needs. And I'll talk a little bit as I go along with our personal experiences as well as some of the things that we have found in the research. So the next few slides, both Judge Schma and I will be talking about some of the complex women-specific issues. And the first quote that talks about women entering treatment or entering these drug treatment courts with many coexisting disorders not only means that they have these problems, but they're concurrent stressors. In addition to their drug addiction, they may be experiencing homelessness, may have an open case with Child Protective Services, and experiencing or re-experiencing sexual and or physical abuse. May be historical, or they may be in a situation where they're experiencing current abuse. Men and women, as Judge Schma said, have different pathways to crimes. Women's patterns of addiction tend to be more socially embedded and revolve around interpersonal relationships. Some factors include economic dependence on their partner, poverty, unemployment, lack of transportation, and overall a lack of independence. Women report more shame regarding their drug use and criminal activity, and this can create an additional barrier to even seeking treatment. Few services are available, and again, this is a generalization, but very few services are available specifically for women. In 2005, there was a national survey conducted by SAMHSA, Substance Abuse and Mental Health Administration, of 13,371 facilities. That survey showed that only 33% of the treatment agencies offered special programs or groups for women, and 9% offered child care. Next slide, please. So some of the common themes as we continue: treatment issues, relationship issues, and systemic issues. A lack of services for women specifically that are gender responsive come often from organizations not really understanding specific treatment for women. Often they will separate women but use the same curricula or curriculum that is used for men, just put them in different groups. This is not effective. In the agency that I ran early on in the 90s, long before evidence-based programming, we recognized the need for women to be in a separate group, for them to feel safe when discussing their specific issues, and that they had specific relationship and other ways to achieving sobriety and independence. our female clinicians did a lot of research and developed a curriculum specifically for women. Often they're a long wait list, especially for residential treatment. And if there are no services in the treatment agency while they are waiting, this can discourage women from even continuing on whether or not they're in a drug treatment court. So you might consider doing waitlist groups, continuing on with one-on-one therapy, having more frequent court appearances to keep the women engaged. Many outpatient or intensive outpatient community programs do not have on-site child care and assume that women will arrange for it on their own. Lack of child care and transportation lead to absenteeism, which leads to sanctions, which leads to missing treatment, and the spiral continues downwards. In our agency, we did not have on-site child care. We noted this was a problem, and we contacted a local university. Two senior students took this idea on as a project, and they created an on-site child care program for us at the agency, which greatly improved women's connection with us, and it also improved their attendance. Shame and stigma. Women often perceive that people even label them as drug addicts and that they're singled out because of their abuse and their lifestyle choices. Often their family doesn't understand what they're going through, and many times women themselves don't understand that addiction and mental health are treatable diseases and disorders. Relationship issues. They often feel that they are failures and don't live up to society's expectations when they're mothers. Thus, they fear losing their children. Again, the issues of shame and guilt and self-esteem overpower them. They fear losing their partner, even though they may be living with a substance abusing partner. And if they seek treatment, then they fear losing that relationship. There are a lot of barriers to women accessing treatment, and the judge talked a little bit about this. Those are systemic issues. Women often lack financial resources. They can't pay for treatment. They're unemployed. They don't have any transportation. The treatment center may be a long ways from where they live, if they even do have a home. Oftentimes, the community lacks clean and sober housing that is monitored and supervised. And overall, and this is one of the biggest challenges, and the judge just spoke about this. I love that vision of the court in the center and the spokes on this wheel. Services and communities tend to operate in silos. Women have extraordinary multiple needs, and it can be overwhelming and unmanageable to try to access these services on their own. Next slide.
A brief picture of the folks that come in women's courts and the background that they present with. Of course, all drug treatment courts are for nonviolent offenders. That term has different meanings in different communities, and so you will find some people with low-level assault issues, that resisting and obstructing kinds of cases, or older assault cases that may be eligible. But for the most part, you won't see many of the women coming in with that kind of a background. They're nonviolent crimes that have a common thread, and they are usually to obtain money with which they can buy, and important to understand also, share drugs with others or provide drugs to others. In most cases, a male who is using them as a source of drugs, and then before they know it, they're drawn into the misuse of it. Some of the crimes that you'll see are shoplifting, prostitution, uttering and publishing fraudulent kinds of offenses related crimes, also drug use and possession, and some small amounts of distribution. But they have that common theme that binds them together as they're looking to obtain money that they can use to buy more drugs. Next slide.
This slide talks about mental health issues and substance use. Trauma and complex post-traumatic stress disorder is common in women that we see coming into our courts. Repeated childhood sexual abuse, domestic violence may not present initially, and we're going to talk about later on some screening tools that may get at this, some of these issues, but women later on in treatment may report cues that will be helpful to the clinicians and or the judge. Problems sleeping, nightmares, flashbacks, for example. There's a higher prevalence of mental health issues noted by women coming in to treatment courts. One New York court study noted that 30% had attempted suicide, had been institutionalized, or were receiving counseling at the time that they entered the court. This next quote typically present with a more severe clinical profile than men, despite having used less and for a shorter period of time. I did some research on this and found, some of you may know about this, a phenomenon called telescoping, which is an accelerated progression of addiction with women, specifically using opioids, cannabis, and alcohol. And that is noted under the reference, the NIDA reference. The other point that we discussed are that women are more susceptible to craving and relapse than men. And again, I found a couple of studies that I thought were interesting. One shows that women metabolize substances differently than men, and there may be more interrelated complex problems between neurochemical systems and the lack of coping skills. Another study shows that there's an overlap with processing stress and drug cues. These are not on the slides, but we can provide them to you after this webinar. Family, we've talked about this. There may be, in many cases, an economic dependence. Women may be living with a using partner who may also be the partner, the quote-unquote, I love you, physical or emotional abuser. This in itself is an extraordinarily difficult cycle to break. There may be instability at home. If she lives with family, they don't understand her and her behavior. Relatives may be tired of caring for her children. She may be a single parent. Many are single parents. And any of the attendees on this webinar, if you have ever been or are a single parent, just think of the stressors. Even though you have a job and you live without addiction or mental health or trauma issues, being a single parent is another stressor in itself. Women in treatment can be separated from their children or at risk of being separated from their children. We found a champion, a CPS worker here, who had a caseload, but some of her clients were in the drug court. And she worked closely with our clinicians, and she also helped us to create a relationship with other CPS sites and other workers around the city. So breaking down some of those barriers that sometimes CPS workers tend to have about women. Lack of self-esteem, self-respect, lack of confidence, it goes without saying they are more likely to be unemployed. Our next slide, back to the judge.
Just one thing I want to add on this notion of how women become more severely addicted and how their addiction occurs differently than men is, I want to refer you to one of the documents that's in the resource section of this presentation to follow from the Department of Health and Human Services Office of Women's Health, and it's on opioid use and misuse, and I encourage you to take a look at that. It's available online. Just to support and follow up on what Val mentioned, from 1999 to 2010, basically a decade, deaths by overdose from prescription painkillers among men increased by 237%. During that same time, the increase among women was 400%. And by the same token, between 2002 and 2013, heroin use among men increased 50%, but among women, it increased 100%. And per the CDC, among the reasons that they cite why this could be accounted for, although they're not positive, but one could be that women are more likely to experience chronic pain in their life and to use opioid prescription medications more often and also for longer periods of time and also in higher doses. So those are the kinds of things that you need to respond to, be prepared to respond to when you have women in the drug court. Kind of historical piece here is the Women's Treatment Court in Kalamazoo. It was established in 1992. At that time, it was one of the first dozen or so courts in the country, and it was the only women's drug court in the country. There's not much available in literature right now about how many women-only drug treatment court programs there are in the country. There are not a lot of them, and the reasons could be resource related. But the fact that this one has been going for 25 years, I think, is evidence of the fact that at least in one community, they've found there's really good reason for continuing it and maintaining that specific court. And they're making whatever adjustments are necessary to be able to continue to do that. That court was created for some interesting reasons. One in particular is that women were underserved in the court system back in the early 90s and late 80s in all communities. And there was a real issue of due process for women because many women were being, at that time, incarcerated. Women with substance use disorders were being incarcerated for reasons where men were not being incarcerated because there were treatment programs available for men. And so that was observed by us, and it was of concern to the bench in this community. And so we looked to addressing it in this way because we became familiar with the drug court system that was just starting at that time. It's important, I think, to understand in creating that that court that it was a collaborative effort. It's back to the spoken wheel issue again, that we needed to reach out into the various aspects of the community where women came into contact, whether it was maternal services or mental health or treatment for substance abuse, and the like, to bring them to bear. So we weren't working as Val explained, in a silo kind of a manner. That same system has been continued today with a policy council that oversees now in Kalamazoo some 7 treatment courts that all come under generally a single umbrella. And it was all started from that one place that it began. I think going to the next slide, that when you talk about the importance of this and the need for this, it's a matter of one of the whys, as you're talking about why to have a program like this. It's a matter of integrity of the justice system. There's an inadequacy in the traditional system for treating disorders of all kinds that come through the criminal justice system, whether they're substance use disorders, mental health disorders. We have simply not served well the people that come into the system, and we haven't served the communities well, frankly, that have need of criminal justice services that make a difference in the community. And so the general gender responsive treatment court system took off, and it did result in better performance, more positive perceptions in the community, and it makes a significant difference in the lives of the women that come in there because of the issues that we're talking about today and the difference that they bring with them. It's hard to start a treatment court for anybody. It's especially hard to start a treatment court for women. You need the right kind of a person to preside over that court, starting with the judge. Not any judge can be a treatment court judge, and especially not any judge can be a treatment court judge if you have a gender-specific court, because not every judge appreciates the importance of gender-specific responses, as we've talked about early on. The most important criteria for the judge, obviously, is commitment and also an awareness of the uniqueness of the issues that women present when they come to court. And of course, all judges, frankly, in all courts need to develop these principles. It's not impossible to look forward to a day when there won't be treatment courts, because judges in most courts would understand what we're talking about, but at the present time, it's not the state of affairs. So the judge has to have a certain personality to do this. They have to be comfortable with this non-traditional role of a judge in the justice system. Not all judges are psychologically comfortable with that role or tuned to it. No judges, I can tell you, for the most part, are trained to sit in the non-traditional treatment court setting. So there requires a unique personality that can make that shift from an adjudicative, frequently punitive mentality to a treatment supportive kind of role. The judge has to be personal, but professional. That personal aspect is not really a comfortable zone and space for a lot of judges. They are terrific judges. It's nothing good or bad. It's not a judgment of that at all. But it's just not the way they like to be a judge and relate to it. So that has to be looked at when you're talking about putting a program together or continuing a program from year to year as it matures. They have to be aware of boundaries. These are particularly important when you're talking about the gender of the judge. We in Kalamazoo have over the years had men and women judges that have served in the treatment court. They have all made themselves aware or been aware when they came in, of the unique needs that women experience and bring, and the unique incentives that will help them through their journey. And I frankly have no personal prejudice one way or the other as to whether it should be a male or female. I think they bring different talents to the court. Whoever it is certainly has to be aware of topics that have to be treated with delicacy that women will be talking about with the judge in the courtroom, and talking about with counselors and with treatment professionals out of the courtroom. But that could be pregnancy, history of sexual abuse, or a history of mental abuse, HIV status, and it's especially important early on in the relationship of a judge with a candidate to understand these issues. When a woman comes to the court, if she has particularly a background in abuse and is confronted with a male judge, that judge is inevitably going to experience considerable hostility from her and suspicion. And it's up to him, and it'll be harder if it's a male, to overcome it. But one way not to overcome it is by being overly aggressive in the beginnings of the relationship. They have to be patient, the judge does, and tender, understanding that there are things that simply can't be talked about, particularly at that early stage. Part of the person being personal is being familiar with the individual, with the woman and her relationships, her family, what her personal circumstances are. The men in a treatment court are pretty perfunctory sometimes. They are kind of anxious to get in and out. Women, as they become comfortable, are happier with the establishing a relationship with the judge. So the right judge also understands that they are the leader of the treatment court. They don't pass that off on somebody else. They also see to it that they make sure that they get adequate training and don't just fly by the seat of their pants. Val, on screening instruments.
Screening instruments. These next two slides are suggestions regarding the specific screening instruments, but what's important is that these areas are applied, some by the clinician, some are self-report, so that you can get a larger and more robust picture of the women and their issues as they come into the court. So it's self-explanatory. There are a couple of alcohol and drug screens, and each of you, each jurisdiction may already have your own that you're using. That's perfectly fine. Criminal history usually done by the probation or Department of Corrections. Some are very state-specific, so they're not LSIR or the Compass. These are suggestions for gauging the level of trauma, the life event checklist, and the trauma history screen. If we could go to the next slide, I'm going to move through these pretty quickly. Thank you. Important to get a picture of the PTSD, separate from trauma. PTSD can be a separate event, or it can be complex, combined with trauma. These are a couple of suggestions. Structured interview from the CAPS-5, or the Post-Traumatic Diagnostic Scale. It's a self-report measure, and clearly you want to get a picture of their mental health status. So there's a mood disorder questionnaire you might decide to use, which I'll identify bipolar, and the patient health questionnaire helps identify and measure the severity of depression. The most important thing, in my estimation, is that the results of each one of these tests and the diagnosis are brought to the team so that the entire team understands what the treatment plan is, what the case management plan is, what the supervision plan is, and what the court program plan is, which may change as the participants go along. So you have an initial entire picture of the woman, the female participant, and as that person moves and changes through the court, some of these can be revisited. You want to look at when it's time to do treatment plan review or case plan reviews. And the cost of these vary, and I will leave it up to you to do some research if you don't have these screening instruments that you're using.
You can see the material on this slide. It's basically self-explanatory. I would suggest that the largest, greatest incentive that exists for a woman in a recovery court is a positive relationship with the judge, and in particular, if abuse has been an issue with a male judge. And it behooves the judge, male or female, to make sure that they establish that relationship, and we've been talking about some of the things that can be done to do it. Rewards that are unique that are meaningful to women and their children and families are always worth using as positive rewards for positive behavior. And on sanctions, I'd say more than anything that in addition to what's on the slide, that they should never, never be humiliating to the person. There's nothing that is more degrading, and not only after a relationship has begun to be established, but in front of another a group of women like themselves to be humiliated. Next slide on treatment program.
Treatment programming needs to meet the standards of care for treatment courts, and NADCP has issued both volumes 1 and 2. These are required references and standards for all treatment courts, and they should be living documents that you can open and refer to often as your court continues to operate and move and is fluid. We have the 6 dimensions of the ASM criteria. That is also a requirement for any treatment agency that is licensed and certified. They should be following and developing a treatment plan based on these 6 areas of the ASM criteria, using the Diagnostic Statistical Manual number 5 as now integrated not only substance abuse, mental health, PTSD, and trauma. Gender-responsive clinicians, female clinicians work with women in groups and individual counseling therapy. And this is true for both the treatment agency and referrals to specialists. You need to be trained and in specific evidence-based programming, which we'll talk about in a little bit. And I did want to mention that I left out a specific screening tool. I did not identify one, but the women also need to see a physician or some kind of medical practitioner. They come in with, often the judge mentioned chronic pain, often have HIV, STDs that haven't been attended to, so it's very important to get a sense of what medical issues they're also presenting with. Next slide, please. Thank you. And these, again, are suggested evidence-based curricula that have been around for a while. They are on Hampshire's National Registry of Evidence-Based Programs and Practices. It's a searchable online database that you can go into and look specifically at the details of these. Speaking safety has been found to be one of the most useful approaches for coping skills. Dr. Covington has done a lot of work in helping women recover, and both from substance abuse and trauma. Dialectical behavioral therapy and eye movement desensitization and reprocessing, or EMDR, are higher level, more expensive, but certainly worth it in many, many instances. And it's possible to get one of your clinicians trained. There are different levels that they can be trained in. When this happens, though, the most important thing is to choose ones that are most appropriate for your female participants' needs, again, based on what the diagnosis and the screening tools show you. Be proactive, I would say, and don't settle for less because you have a curricula that was already in existence or you have something that was inherited. These are just a few that are on the National Register. And if we can go to the next slide, whatever you choose must be delivered by female clinicians that have training and have a certificate or certification in some respects. Please do not cut and paste curricula from different treatment manuals. I've seen this out in the field, and it just reduces the fidelity to the model. These curricula that are evidence-based have been vetted, they have been reviewed, and they have been looked at clinically and scientifically. So fidelity really means that there is an expert that sits in the group, makes notes, makes observations. It can be a clinical supervisor who's been trained. In our case, we hired a consultant that had been trained who came in. She was not on staff all the time, but she came in and oversaw and ensured that we kept fidelity to the model. Overall, you want to make sure that the standard of care meets individualized treatment planning for each woman. Offering gender-responsive treatment does not mean that all women receive the same set of curricula and programming. You still need to provide services based on each person's individualized treatment and case management and supervision plan. Judge.
When you review this slide, you can read what's on it. Keep in mind the spoken wheel analogy that I mentioned earlier. This is really the kind of an example where it comes into play. The court acts as a convener and an accessor to these various kinds of care that exist in the community or that are created for the purposes of the court, but more often the former. What is important here is the fact that they are that they're multiple in number, that they're comprehensive, that consider all the various kinds of circumstances that any person, but particularly women, may have, and addresses those needs. And what's really important here is that the court is going to take responsibility for getting this done. That's the bottom line. It's going to create those links. It's going to follow through and make sure not only that that people are that clients have them available to them, but that the clients follow through and access those when appropriate. and when needed, and then the court insists on and follows through with accountability. One of the most important services that can be accessed, of course, is parenting courses for those people who have children. There's a significant reduction in relapse and relapse to continued drug use or relapse into continued criminal behavior by people that have had an opportunity for parenting courses. The reason for that is that children are such a magnet for women in drug treatment courses. Most of them, I found, would describe their main motivation for recovery and for participating in the court and going through all the things that are required is their chance to either regain custody of their children or to continue in custody of their children. Next slide is aftercare.
Aftercare, many programs have certain types of aftercare. We had a formal one as a treatment agency even after the woman had graduated from court. But after that course was over, we maintained an open door policy. So a graduate could call for an appointment and see her counselor anytime. One did it for several years and now is a successful professional. And the court may consider the same type of open door policy. I'm not sure what Judge Schma says about that, but being available to women after they've completed this program, this formal court program and formal treatment program is vital. Safe housing, difficult to do. Ideally, we would have those listed on the screen. Where they don't exist, I've visited locales where faith communities raise funds to buy a house for women. I've also visited a place that was, with the best intentions, created a transitional house, but they only had a manager on duty during the day, and it was co-ed, which you can imagine the types of problems and that caused, and it became an overwhelming issue. Relapse prevention plan is developed early on in treatment, includes all the aspects of the needs of the women that I've spoken to before: substance use, healthy relationships, trauma triggers, parenting training, risky behavior, medical issues are just a few. Continuing access to health care and medications. The judge talked about this earlier, but I want to emphasize to make an effort to bring as many on site, either in your court if that's where your treatment agency is, or to the treatment agency. If you don't have the money to do this, we developed a relationship with our local naturopathic school because we couldn't afford a medical doctor, and they provided physicals and ongoing medical care. That they were supervised by an ND doctor, and the interns did the work, and it still is going on. We worked our budget one year to find funds to hire a contracted psychiatric mental health nurse practitioner to come on site, to do the therapy, to provide medications, and to continue to see the women. So breaking down barriers, making things as easy as possible for women to access services. Next slide, please. These are some strategies for developing a gender-responsive program. We found that after women had been in treatment and had some successes, they were more motivated to then step out and start a reunification process with their children. Peer mentors or peer supports are gaining popularity around the nation. I've seen that they are extraordinarily beneficial, not only to the women, but to the court and other practitioners also. You can access SAMHSA. They've done a lot of work in its recovery to practice. They've developed a curriculum, worked with International Association of Peer Supporters. NDCI has a rural listserv that's very active right now, and there are a couple of trainings, one in Missouri, one in Colorado. I don't believe any of these are evidence-based at the moment, but they are practical-based. Just a few notes on trauma training for the entire drug court team. Number one, you have to have a commitment from the judge as the leader to start this, to take another view and understand what using trauma-informed principles mean in strategic planning. Go back to your vision, your mission, and value statements and see if they include the approach the judge talked about, the way, the language that is sensitive to women. Create a trauma-informed oversight committee. Conduct an organizational self-assessment on trauma-informed services, and then develop an implementation plan. This sounds like a lot. It is a lot, but it's not impossible. And there are courts around that are beginning to recognize the need for developing an entire shift in language and approach from all the drug court team members. Next slide, please. Respond quickly at the time of arrest. When a woman is arrested, she's in crisis, and it's an opportunity to take, to create a relationship with her, to administer the intake and the screening as quickly as possible. If she is in jail, send personnel into the jail and try to move to arraignment into a court program, ideally within 2 weeks from the arrest, and continue to work to reduce the time and the barriers that often courts still set up. These can be interpreted by women as, what if they don't want me? Lengthy delays can continue to send reinforcing messages of shame and guilt, whether we mean to or not. Refer women as soon as possible to treatment. If not, create a pre-treatment group, as one New York court does. There's a court in Texas that uses a community organization to reach into jail the day after the arrest and start pro-social relationships with women. Again, relationship is the key word here. Identify their needs, we've talked about that before, and bring the results together as soon as possible so the team is all on the same trajectory of care. And most of all, be flexible. Programs must adapt to changing needs of participants and consider new research and evidence-based programs. And I know we get into that hamster wheel of we're just trying to do our jobs and get through the court docket and get through the treatment groups, but keep an eye on the changing dynamics and the needs of the participants. Okay.
More strategies. And I think, again, this is an example of the spoke and the wheel, the hub of the wheel and the spokes. You want to make sure that your data that you receive and that you do receive data from all the participating groups which have been accessed on behalf of the client when you talk about preparing a case plan of some kind, and as it gets modified from time to time. Counties that are facing resource issues have to do some particular strategizing. Not everybody can establish a separate court system because of either the financial picture that they are operating under, or perhaps the judicial resource picture that they have to struggle with, and so they can't have a completely separated court. But you can consider having separate dockets within a court system so that on a morning, if Fridays that can be dedicated to treatment courts, in the morning the women come, or the first half of the morning, and the afternoon or the second half of the morning the men come. That safe space that's created that way is valuable. Just some tips on the next slide that are maybe helpful and useful to you. That these are partial responsibilities, obviously. They're not total responsibilities or job descriptions or the basis for an MOU amongst the various participants. But keep these in mind as you assign jobs and make sure that they all get covered. For the judge, the most important ones are commitment, in speaking in a court which is gender specific. There has to be a commitment to doing it, obviously, that transcends what the judge probably signed up for when she or he became a judge. They have to learn the language that is appropriate to be used, as we've talked about here, and the attitudes that are appropriate, as we've talked about here. But the judge has to be the leader of the entire group to make sure that she or he gets trained, that she or he maintains a commitment to what's going on in the court, becomes gender responsive and learns what that means, and make sure that everybody else does that, gets the training to do that, and the judge has to build the sense of team participation and team accomplishment that will make it an effective functioning group. Has to keep it on track to accomplish its goal, and it really has to run the team. It's easy for a judge to defer that job to a coordinator, and in probably most of the courts that both Valerie and I have seen, I think, where we've visited them more often than not for any number of reasons, the coordinator tends to take on a lot of these responsibilities. And my advice to coordinators and case managers is don't let that happen. You've got to keep the judge engaged and involved when they are so they remain responsible for these things. That includes also overseeing treatment, very importantly. The judge and the coordinator both have to understand the treatment curriculum, why it's being used, how it's being used. Ideally, they should visit the treatment facility and, if possible, sit in on treatment programs or sessions so that they can see what's being done. And they have to make sure, going back to what Val was just talking about, that there's fidelity maintained to the treatment process and to the proper treatment process. And you can't do that unless you know about substance use disorders, know about mental health disorders, get trained in it, and also train the team. The other responsibilities that lie to treatment providers, defense counsel, prosecutors are laid out there. I would add, make sure that corrections officers are included in this list of team members that have to be aware of all of these various issues. That's not always easy because they come from a different system, sometimes a state system, sometimes a local system, and for reasons related to caseload and everything like that, those corrections officers bring their own host of difficulties and challenges to the work, but nevertheless they are a part of the team, and they have to, as everybody else, be committed to a holistic, treatment-oriented court for the benefit of the people. So that concludes the remarks from Valerie and myself, and Anna, I think, will have some more comments for us.
Yes, thank you both so much for that great informational webinar. We got a lot of great feedback throughout, saying that was very helpful. So on the screen right now, you can see some additional resources that we encourage you to reference, and our contact information for the National Drug Court Resource Center and the Justice Programs Office. We are currently working on developing a new website for the National Drug Court Resource Center, and that should be out in early 2017. But in the meantime, you can still receive resources and updates by going to the current page listed there or the JPO website. So now we will be taking some questions. Our first question, Val, earlier in the presentation you mentioned telescoping. Can you just review what that is again?
Yes. It is the tendency for females' brains to become addicted quicker. So they don't necessarily start using drugs at an earlier age. I'm trying to find my notes here. What happens is a rapid, accelerated progression of addiction. And the judge mentioned women using pain medication, alcohol. These things may be used for both physical pain and emotional pain. The studies that I found, and I will send these to you, Anna and Monica, so you can distribute it, were studies from the medical field. We know that women metabolize substances differently. We know that in some cases, medications to help sleep, for example, have been reduced by the FDA, and doctors do not prescribe the same strength that they used to because they've learned that women metabolize things differently. Does that answer the question?
Yes, thank you.
Okay.
And then our next question, in a case where maybe both parents may be participants in separate treatment courts, do clinicians utilize joint counseling?
Sometimes we did family counseling. We did marriage and family counseling. We had a separate, again, a contractor because we couldn't afford somebody who was skilled and licensed in that particular type of counseling. So we could afford to have this therapist come in on regularly scheduled times just to see the family members. And I think that would have to be something that would be approved of by the judge, by the team. So, I didn't mention it, but it's imperative that treatment agencies remain transparent and step up. It's easier to, in my experience, it's easier to talk about things that are needed, let's just say marriage and family counseling, ahead of time than asking for forgiveness afterwards.
If I might, Anna, just a kind of an interesting story in that regard, but a useful one. I think our court, when I was doing it, was women specific. But one particular woman who came to the court was accompanied by her boyfriend all the time, and it was pretty clear that he was there to keep an eye on her and find out exactly what she was talking about. But he listened to all the things that were talked about in this court. She started out very suspicious, of what we were trying to do, but over time became a very active participant. And before we knew it, we learned that he was active in his addiction, and we drew him into, we were able to, because he saw her having a positive experience, we were able to draw him into a treatment program, and they ended up going through treatment together, her in a treatment court and him in a treatment program, and eventually down the road I had the privilege of marrying them. So you never know where those things will carry you.
That's a great story. Thank you for sharing that. Another question we have is, how do we get participants to the program within 2 weeks? Do you have any examples of courts that have been able to do so?
Well, I have the example of my court. It's more challenging now, I know, because most courts are post-adjudication. You have to take a plea. There are some courts around that still require the person to take a plea, but they don't have to go through all the steps where the district attorney and the public defender are negotiating the terms. Things are decided up front, and it's the prosecutor that obviously is the gatekeeper and oversees all of this. And it really has to do with the front end, making that commitment to get women, we're talking specifically about women, but I include men as well, as quickly as you can from the time of arrest into treatment is the best thing that you can do. And there are ways at probation officer or the prosecutor gets the rap sheet from the night before who was arrested. You already know who your participants are going to be, what crimes are acceptable for your jurisdiction. You can have a review of that. Somebody can take that booking sheet right away, go into the jail, do a screening, and move the process along, rather than waiting till all the screening tools are done, coming to the table, having a discussion, and we who look at places absolutely now, and this is a NADCP national no voting. We don't have crystal balls. We don't know who's going to do well. But as much as you can do up front to have a checklist, that's already decided by the prosecutor, the court, everybody else. If they meet the criteria, then you move it along. Judge Schma, I'm sure you have some comments on this.
Well, implicit in what has been said by Valerie, I would suggest that this all goes back ultimately to having a well-functioning team that includes all the people on that chart that we went over, including corrections officers. Have a well-functioning team, a team that's equally made up of equally committed partners, and a team that's well-trained. And if you have all of that, I can guarantee you that team is going to find a way to shorten the process. It's just a matter of will. That's all it comes down to. And if you've got a judge and a treatment or a coordinator huddled together and alone without the participation active of these other players, you're going to run into these problems all the time, and it's not going to be moved quickly. But if you have, particularly as Val suggested, if you have a committed prosecutor involved, then it's going to happen because they want it to happen. And there's ways around it everywhere, and it's just a matter of juggling schedules. It's taking things out of order sometimes. It's a matter of changing the way you do things. And not everybody wants to do that unless they have a project they really believe in. So, and again, this goes back to the judge's leadership role. The judges have a role in the community where they can step up and make these things happen, even working with elected prosecutors who are often key to the whole thing, but a judge who works well with the prosecuting attorney's office can help to get those things done.
I have a couple other thoughts on this. Every team member, if they're not passionate about this work, they don't belong on the team. And that sounds a little harsh, but in my experience and my observation in the field, it's true. This work is hard, it's different, it's not what most people learned in school, and as Judge Schma said, they have to be willing, and the judge absolutely has to be willing to be a leader and step out from behind the bench. Go talk to the prosecutor. Go talk to the defense counsel if that's an issue. He or she is the only person who can do that. The other thing I might suggest, if you have some women who have failed and you're not sure why, pull some of those files and take some time and do a social autopsy. See where along the line you made decisions, and it may have been at the front end. They may have sat in jail for 3 months. We don't know. It may have been further on in the program. But taking the time to do a social autopsy on somebody who has not been able to be successful can be very valuable for the entire team.
Val's suggestion correctly implies that the responsibility for the success of not only these programs, but the individuals in the program are with the court. And if there's somebody who's not making it, instead of looking first to why they failed of themselves, the team should look to why what the team offered was inadequate, offered by way of programming or treatment or anything else. That's a demonstration that the court is the committed court, that this is has an extremely high priority.
Thank you both. And then our last question is just if you could expand on types of sanctions utilized. There have been a couple questions on that topic, just more specific questions.
The types of sanctions utilized?
Yes, for non-compliant behavior.
As I mentioned, they should not induce shame or blame. Also, I would keep in mind that the greatest motivating factor, I think most people will agree, in a court with women is their children. And so it's allowing them to have, there's a court in Michigan, Van Buren County, next to Kalamazoo, which just recently joined together a women's specific treatment court with its family dependency court. And the judge that did that intuitively picked up on what I happened to run into along with a family court judge in Michigan, Kalamazoo, when we started all of these programs. And that is, we were seeing the same people. And so if you have opportunities to link both sanctions and incentives to being with or not being able to be with children in appropriate ways and with appropriate oversight, that has a big has a lot to do with sanctions. Some of the incentives, our female drug court uses incentives that are specific interest to women. They have a, you see a lot of courts with these fishbowl kinds of approach. And in the women's court in Kalamazoo right now, what they do is they don't do that, but whoever's scheduled for approval, or what they call accolades on a given court session, they have they have small items available that they purchase or receive or donated to them that are of help and interest to women, specifically hygiene or personal care products, or for women's children, things that they can take home with them. An opportunity, a real great incentive for a woman who's doing well is to be told before the court session that she should bring her kids to court and introduce her kids to the other people. That incentivizes her, it incentivizes them, and makes everybody feel good about what they can accomplish, and they see that it is possible to accomplish something. So, and other, a judge has the ability to do something like perform a marriage for somebody, or show up at somebody's child's graduation. Giving a client an opportunity to talk in a courtroom about what's going on in their family is a real reward and an incentive. The sanctions are, also the short jail sentences are sometimes necessary, but it should be the last resort. And always, for any kind of a sanction, the case management plan should be considered by the team as to whether there's something else that could be done that's not been done that led to whatever the relapse may have been.
Great, thank you. So that's all that we have for questions. I do want to note, though, that the slides and the recording of this webinar will be made available to everyone early next week, and we will be posting those to both of the websites. So thank you both, Judge Schma and Val. Thank you both very much for this great presentation. We really appreciate it. And thank you all for tuning in today.
Thank you. It was an honor.
Thank you.